Hello, and welcome to today's webinar, The Path to Youth Justice Reform. My name is Josh Rovner, and I'm the Director of Youth Justice with the Sentencing Project. Joining me today as moderator is Michelle Milchman. She's the Executive Director of the Coalition for Juvenile Justice. We're both grateful to the Annie E. Casey Foundation for their support of today's webinar, where we're going to discuss the most recent reports from the Federal Coordinating Council on Juvenile Justice and Delinquency Prevention. These were remarkable and visionary reports created in collaboration with government officials, community members, and other experts, submitted under the leadership of former Administrator Liz Ryan, though I suspect some in our audience aren't familiar with the Coordinating Council. A diverse spectrum of experts created these reports, and lucky for us, two of the members of the council have joined us today. Michael Mendoza is the National Criminal Justice Director for Latino Justice, PRLDEF. Michael has been an advocate for reform for more than a decade, particularly regarding removing children and adolescents from adult courts, prisons, and jails. He himself was directly impacted by the justice system at a young age. We're also joined by Mark Patterson. Though now retired, Mark was the administrator of the Hawaii Youth Correctional Facility. Hawaii is a state that implemented many of the reforms we'll discuss today, sharply decreasing its use of out-of-home placement and achieving the remarkable milestone of incarcerating no girls whatsoever for a time under his leadership. We're also joined by the former senior policy advisor at the Office of Juvenile Justice Delinquency Prevention, Jill Ward, who is presently the director of the Center for Youth Policy and Law at the University of Maine Law School, where she divides her time worrying about the Red Sox and running the school. So you'll learn more about each of our panelists during their presentations. As I mentioned already, I'm the Director of Youth Justice with the Sentencing Project. TSP advocates for effective and humane responses to crime that minimize imprisonment and criminalization of youth and adults by promoting racial, ethnic, economic, and gender justice. I have a few housekeeping updates to discuss before I hand the microphone over to Melissa, who will introduce herself next. First, the webinar is being recorded, and we'll be sharing the slides and the recordings sometime next week. As we'll say repeatedly today, we urge you to share the reports and the recordings as soon as we make that available. In fact, the invitation to the webinar that most of you signed up for have links to the reports. We hope that you will download them and share them with colleagues. Second, we'll have time for your questions after we hear from the other panelists. So please submit your questions in the Q&A box. Please don't use the chat box. I'd really like to encourage you to use the chat box to chat amongst yourselves. And feel free to take a moment to type in where you are listening, joining us today from. However, the questions for our chat should be in the Q&A where I can see them and direct them to our panelists. So thank you very much. I'm going to hand it over to my partner, Melissa. Thank you so much.
Thanks, Josh. My name is Melissa Milchman, like Josh shared. I am the Executive Director for the Coalition for Juvenile Justice. CJJ is a nationwide coalition of state advisory groups and allies and practitioners that are dedicated to preventing children and youth from becoming involved in the courts and upholding high standards of care when young people are charged with wrongdoing or enter our youth serving systems. I'm excited to be here with you all today in celebration of the launch of these really important reports. As many of you know, last year was the 50th anniversary of the Juvenile Justice and Delinquency Prevention Act, or JJDPA, and the work that happened in the Coordinating Council for Juvenile Justice and Delinquency Prevention, you will likely hear it referred to as the Coordinating Council, culminates nearly 2 years of work from 11 departments across 9 agencies and 10 practitioner experts, and we're really excited to hear from them today. You are going to hear from experts who worked on it and some of the core content areas of the report around the Continuum of Care framework, the roots of the report in the JJDPA, the importance of federal leadership in the development and the publication of this work, how these reports were created, which was really unique over the period of time that the coordinating council worked together. And then we're hoping to share with you some resources so that you can have access to the reports and share some action items with the field. And then, of course, you'll have an opportunity at the end, as Josh shared, to engage in a question and answer period. So please make sure you're putting your questions as you have them in the chat. And I will be kicking it now over to Jill Ward to share more about the root content of the reports. Thanks, Jill.
Thanks, Melissa. Yeah, it's really great to be with all of you here today. And I'm hoping and guessing there are lots of folks who are doing this work out in the field and will find this information and the existence of these reports really helpful in your work. That is at least my hope and goal for this short webinar. So I'm going to just start off. Melissa outlined very briefly there what the Coordinating Council is. And it is this collaboration between the federal department agency heads and then a series of appointed practitioners from the field, and they're appointed by congressional leaders and the president. And the design of this is very strongly rooted in the JJDPA and section 11116. There's a whole section on the establishment of the council and its purpose and functionality. And I think it's really important to ground our understanding and why these reports are so important in this understanding of what the function of the council is. And so per statute, the council is designed to examine how programs can be coordinated better to serve youth. And this is directly in the statute. It's there to coordinate policies and priorities across the federal agencies. It's to look at whether federal funds are consistent or inconsistent with the core protections of the JJDPA. So that's the deinstitutionalization of status offenders protection, the jail removal protection, the sight and sound protection, and the reducing racial and ethnic disparities protection. It is there to coordinate and consider joint funding ideas. And it is also there to look at why youth might be being held in federal custody and to improve those practices. And so it's really got quite a range of duties, but I think if you think just from a common sense standpoint, it has value in that it gets federal agencies not working in their silos and really trying to coordinate across the federal agencies at the highest level in what the federal guidance and responses and recommendations are for young people who may be at risk of or end up in the justice system. And, you know, I like to think about the establishment of this coordinating council to be very much in line with the way those of you who are out there listening who are part of state advisory groups. If you think about the structure of a state advisory group and some of the purposes of that entity at the state level, this coordinating council does a lot of the same functions and is really intended to do some of the same things around making sure there is alignment and there is coordination amongst entities that touch young people and are responsible for responses to young people. So I think thinking about why it's necessary, you know, I've touched on a little bit of that kind of coordination. It's also really important for the leadership in the federal agencies to take stock about what's actually happening on the ground to inform that federal work and that federal leadership. So it is in the statute that this coordinating council meets and produces an annual report. And I think what is also very significant about the report, this report and this sort of companion practitioner report that we're going to talk about is that it's the first time that OJJDP had released this report that was required since 2008. So it's been a big, long desert of this kind of coordination and coming together to provide the kind of sort of general findings and then recommendations for the field. So really excited to be able to share it with you and encourage you all to sort of take a look at what it is and sort of what its purpose is. And I think if we go to the next slide, I'm going to talk a little bit about how OJJDP approached this work and doing the work to get to the report. So to help the council when it convened, think about how to meet those functions that I just talked about that are in statute. OJJDP adopted the Continuum of Care framework, which I hope many of you are also familiar with. And this came from a couple of different places. first and foremost, I think it's important, again, much like the council itself, that the Continuum of Care framework really was dictated in statute also. In 2018, when the JJDPA was last reauthorized, it added a fourth core purpose to the underlying law. And I'm going to sort of read that purpose because I think it's really important and foundational to how the approach of this coordinating council worked in the 2 years that led up to this report. So section, and the lawyer in me has to give you the section, section 111024 says that the purpose of the JJDPA is to support a continuum of evidence-based or promising programs, including delinquency prevention, intervention, mental health, behavioral health, and substance use treatment, family services, and services for children exposed to violence that are trauma-informed, reflect the science of adolescent development, and are designed to meet the needs of at-risk youth and youth who come in contact with the justice system. I think that language is incredibly important to have in federal law and is sort of how OJJDP was thinking about meeting this mandate and adopting this framework, not just for this report and to help guide the work of the council, but really in all the work that OJJDP was doing around grant making, around framing out sort of what a continuum of care for young people looks like and how to think about resources, coordination, collaboration, all of those kinds of things. And you will see from the graphic that sort of lays this out, that's also included in the report, that youth and family and community are right in the center of all of that. So really important sort of setting the table for this conversation. So where else does this report come from? It comes within this framework from all of you in the field through listening sessions, town hall meetings, the council meetings themselves, and other outreach, how those recommendations and those focus areas came to be in this report were informed by you. And you're going to hear a lot more in a minute from my colleagues who were part of the practitioner report and really did a lot of the hard work that got that piece of the vision completed. And then third, sort of where does this come from? Answer to the where does this come from question is the science. You know, as I read in the statutory mandate that exists, this process really recognized the importance of research on adolescent development, what promising, proven, evidence-based, all the kinds of practices that have results-based positive youth outcomes at their center was also sort of another element of where all of this came from. And again, with that holistic approach of young people being at the center. So next slide. So what did this report tell us? So it was a 2-year process that again focused on the field and encouraging lots of input from impacted communities, young people who had been system involved, families who had been system involved, and we're going to hear some more about that. And the 2-year process was guided by a set of principles that I think are really important to lift up, again, that sort of help speak to where we got to with respect to the recommendations. The key principles were no new silos, so no silos at the federal level, to reduce the administration of providing supports and services to young people for communities, so make it low barrier to really help our young people. Programs should be trauma-informed and healing-focused. Solutions should increase community access to supports and opportunities. And part of that is the reducing the administrative barriers. All stages of the continuum are important, but prevention should really be prioritized because, as we know, the more we can keep kids from even touching the system, the better off they're going to be. Coordination should deepen cultural competence. So, you know, really sort of grow the understanding of the young people that we're working with and where they're coming from. And that agencies should hear from and engage with impacted community members with lived experience. So with those principles sort of underpinning the meetings and all of the work and the outreach that I just described, the council came up with 5 priority areas that are there for you on the slide. which you can read for yourself, but I'll just run through really quickly. Direct funds toward root causes, have responsive services to the behavior, so the services matches the need of the young person, access to mental health services, incentives to reduce the use of incarceration, and improvement around reentry. So I encourage everyone to take a look at not just the report for these priority areas, but then there are 18 recommendations that support implementation in these areas that are directed primarily to Congress and the administration, the president. And why is this report important? It provides really important national leadership and a roadmap for the federal level, for the president and the administration and related federal agencies and Congress on all of these issues, and really can help guide funding priorities. It's informed by the field, so that makes it even more relevant and on point. And I would really encourage, when you look at it, and I'm sort of getting up to my time, but to look at the document and think about how you can use it in your own work on the ground. It can inform state reform efforts. I would suggest SAG members think about it in the context of your own state's 3-year plan and how you're investing Title II funds. I think you'll find that there's some synergy there, since a lot of the information that's in these reports should be reflective of what you're seeing in the states, what the needs are of the young people that you're trying to help. So I think SAGs could really take this and run with it. And it really does provide information and ammunition, if you will, for advocating for these kinds of things on all levels, whether it's the federal level or the state level or even the local level, of the kinds of things that need to be invested in and the efforts that should be coordinated to really meet the needs of young people in our communities. So I think with that, I'm going to pause and happy to take any questions from the group, and I'm going to turn it now over to Michael and Mark, who are going to talk about the process of the practitioner's report and how that came to be and what it says.
Mark, you want to kick us off?
Oh my God. Aloha, everyone. Glad to be here. Glad to share and talk with you. We're just, me and Michael are just two West Side guys here to share with you our experiences. As you heard, we were chosen by different entities within Congress itself. And I came to the attention of the Senate Committee on Indian Affairs due to my work with Native Hawaiians and historical trauma. Yeah, and how historical trauma has affected the trauma that was going on in the communities, in the homes, and how do we approach the system in a more therapeutic and healing fashion based on the trauma that we know exists, and how do we stop intergenerational trauma, yeah, to keep our young folk out of the juvenile justice system. Now, I say it like that because that's how I came to their attention, but really it can be related to any group of people throughout the country in terms of the historical journey in their communities, yeah, and how it's very difficult to break that cycle. And so with that being said, that's how I came to the Coordinated Council as an appointee by the Senate Committee on Indian Affairs. And just really wanted to understand that to walk into the Coordinated Council in our first meeting a few years ago, it was impressive to be there among other practitioners that were chosen as well, but also to see the federal agencies that were present there. It was a very large group and very impressive to begin to work. And I'll just say a few more and I'll let Michael take over. When you work at the state level or the county levels, you know, the whole challenge is always how to coordinate the interstate agencies. Yeah, how do you work together at a state level, at a county level, with all the different groups within those organizations and then bring the community on board. And so that has been my work and my experience in Hawaii. And then going to the federal level and seeing the same organizations at a federal level was very powerful. Michael, you want to go ahead?
Yeah, no, thank you, Mark. I appreciate those comments. You're taking me back to some of the memories that we shared together working as member practitioners as a part of this council. And first, let me just, thank you all for the opportunity to be here so that this report is not forgotten, even though now banned. But what I will say is the way I came to this work professionally and personally is through President Biden. I was one of the Biden appointees, thankfully so, and really appreciated the opportunity and was really kind of surprised, honestly. And I say that because of my own personal experience. Josh mentioned a little bit during the intro that I am personally impacted. And what I mean by that is I was one of those 15-year-old kids in Southern California that unfortunately was involved in a crime and was tried as an adult and received a 15 to life sentence in California prisons. And I ended up growing up in adult prisons for about 17 years until policy saved my life. And what I mean by policy saving my life is that California created the Youth Offender Parole Board hearing in 2013, which allowed me to prove I wasn't the same 15-year-old kid. And that was during the mid-1990s when then Senator Biden was, just like other Democrats and Republicans, supportive of being tough on crime to our children and young people behind a very dehumanizing super predator myth. But since then, and as all of you have been doing amazing work to get us to this point where we are at now, decades later, there I am meeting President Biden, who has appointed me to this council. And in my mind, I was just really happy that he had recognized redemption and was willing to work with people like me. And so just with that kind of perspective, meant a lot to me to be able to be on this council with people like Mark doing a lot of great work, also a former correctional officer. We had, a judge on our committee. We had, people that were just doing amazing work on the ground, now being represented under Liz Ryan's leadership. And it was an amazing experience to see people from the federal agencies sitting around, all there listening intently as we try to conduct our services to make this recommendations, create this report to the president and Congress in hopes that we send a strong message of what people on the ground were working on, what's working, and how it's been helpful. I'll say one more thing, and I'll pass it back to Mark, and maybe we can go back and forth or identifying some important key outlines of this report. But when we started the process of discussing this report and what we were going to say to the president and Congress, it was really important to listen to the field. We took many, many meetings from different states, different partners, different allies, different perspectives, especially young people, on what they wanted to see in this report to the president. And what I'll say is we initially started off with three main priorities: treat kids like kids, treat kids closer to home, and provide youth and young people meaningful opportunities to succeed. I may have paraphrased that, but the most important part is to understand that we treat kids like kids. And we use this report to combat the inhumane narrative of children deserving punishment instead of being treated like children. And so I think those three guiding areas of the focus that we were looking at really helped guide us in this report, listening to the recommendations and really trying to package it in a unique way that can be used appropriately. But Mark, what were your thoughts on those focus areas or our relationships with the federal agencies or anything else you want to share about your experience?
Michael, thank you for reminding me about that. If you take a look at those three items that Michael just spoke about, treating children as children, the first meeting that we went to, they literally brought young adults with lived experience, maybe between the ages of 19 and 21 years old, to the council and give us their stories and where they're at, and what is still needed, what happened to them, and what they wish they had in their journey at that time. And all the recommendations that they gave us served as a guiding post for us in the conversations that happened 2 years after, which is the result of these reports. So it was awesome to start our journey with the coordinated council with a youth voice. And everything always had to be with the youth voice. Yeah. And that helped us define and refine the continuum of care that you see in the book and that we've talked about already. We also got to hear from the grassroots level community groups. Yeah. For the first time ever, Liz Ryan took the entire council and we went to Harris County in Texas. Yeah. And looked at all the great things that were happening there. And it was remarkable. We went to a former facility that housed incarcerated youth that ran the punitive model that was being transformed to a therapeutic community model. And I remember we were actually there during the restoration, and me and Michael was walking side by side, and I was looking at it through my correctional lens, and he was looking at it for his lived experience lens, and we were both sharing. I said, "Oh my God, that was a control box. Now they use it for making music." And then this room was, where they housed them in the dormitories, and now it's for performances. It's amazing how a community can make the change that was once punitive, now therapeutic. Yeah, and I was shocked because with 1.5 million in the state of Hawaii, we think it's a heavy task, and Harris County alone, and of course where Michael's from, is you're talking millions. In the population that you serve. And so it was awesome to see that even in the large populated areas, Harris County, which includes Houston, that this model that we're discussing can be seen as progressive, and that it's doing great things even in our large cities if applied correctly. And so, I can't tell you more than enough that continuum of care model that we talked about is really can be a solution. And I think as we worked with the federal agencies there, when I looked at Harris County, you had to, in my mind, I was imagining, does the federal agencies know what their role in this success is? Or even in Hawaii, does the federal agencies know how important their role was in the transformation of our juvenile system in Hawaii? And I felt that they really didn't know, because they weren't working together. They were just funding their downstream line until they came to the meeting and heard what was happening in the other one, and they would say, "Oh, well, we're there, we're doing this," or "We're there, we're doing this." So the coordinated word that's being used is making them aware that it's happening. How can we be better at it and better do what we do to support the states in their juvenile justice efforts? And so when you look at this, it's really a means of how do we coordinate the different areas, from prevention to the intervention to the reentry, and how do we coordinate better to be more effective in what we're doing. And that's what's exciting about the work. And if you look at the practitioners' reports, we're actually telling the government, this is where you need to put more effort in. This is where you need more fun. We're running, and we've done great, even with COVID. Juvenile justice reform on a national level has been successful. How do we make it even better? Yeah, and this is what this report is indicating. Michael, that's what I'm feeling right now. I'm very excited and passionate about this. How about you?
No, I'm equally excited, and I think the last thing I'll just say or emphasize about my experience being a member practitioner's council, putting this report together, hearing from our beloved community about their work is, at the end of the day, we wanted to emphasize, how children go through adverse childhood experiences, and how children should not be sent to the juvenile justice system. This should be a last resort. And if a last resort, it should be treated in the least restrictive environment, where it's flooded with programs and communities, and where we meet children where they are at with the needs that they sorely need. And so, just for somebody who has lived through those shoes, and who just desires that we figure things out differently for our young people and future generations, I think this report is something that I'm very, very proud of. Comes directly from the field, and we can just keep alive in any way we can. So that's all I've got on my end, Mark. If we're done, I think we pass it back to Josh, but I'll leave it in your hands.
Just that one might want to say, if I may, is just really the importance of the reform, and where we're at now is really continue to work on our prevention and our diversion efforts, but also to begin to focus real strongly, because what we're seeing coming into the facilities at this particular point in time, particularly in Hawaii, is the most vulnerable of the population, where diversion has not been successful. And so we really want to be strengthen our reentry efforts, and our vocational training and workforce opportunities. But I'll be available for more questions later, but we throw it back to you, Josh.
Thanks so much. That was really wonderful. We do have a lot of questions coming in. The first thing that I'd really like to share with people, and we'll put the links in the chats, is encouraging people to download the reports themselves. We will also have a nice summary one-pager on these reports, but in your invitation to the webinar, you received both the report to Congress, the report to Congress and the White House, and the practitioner's report with excellent recommendations in there. We definitely, I'll stop sharing my screen because I think you guys know what the letters Q&A look like. So Michael and Melissa and Mark, why don't you come on back? And we'll start getting to some of these questions. The first one that I want to get to, the webinar today is being recorded. We're also going to be sharing the slides. We'll be sharing the reports. We'll be sharing those one-pagers. Everyone who registered for this webinar automatically gets that when we send it out. Don't hesitate to forward it to your colleagues as well. Michael said something about these reports not being available, which is really a shame. I mean, it's something that we've seen a lot from this administration, of publicly available documents being taken down. It's part of our purpose today, is to make sure that these reports, whatever happens with the changes to the Department of Justice website, that they are still available to the general public, to practitioners, to families, to community members. So please help us in that task. Don't let these reports get buried. I had to do a little bit of digging to find them. You do not have to. We're sharing them with you today, and they'll be in the chats. Among other things that you can do is find a home on your own organization's websites. If you are a member of a state advisory group, to put these up there. These are really mainstream, excellent recommendations put together by experts in the field, defenders and prosecutors, corrections officers, young adults, directly impacted people. And I think I sort of want to start there. It's a question for both Michael and Mark, because I'm curious about the information gathering process, listening to the field. What was that like for you, and how did you find that process might have been different from what you were expecting? In actually listening to experts and not just thinking that those of us who live and work in Washington, D.C. might have all the answers.
Michael, I'll take it from a state worker perspective. You cannot do systems work without talking to the ground level. Yeah, the people who are actually face to face with the child, face to face with the family, face to face with the community or the jurisdiction that you're working in. And so system work, if you cannot have that contact or hear their voices, you're really not doing justice to what you hope to do, And so when they were bringing these people up, and listening to the youth, listening to the community-based organizations, and even some of the government agencies like SAMHSA would make reports, or the Department of Education would talk about what they're doing. When everybody came forward and gave reports, you get a better sense of what's happening, that helped us have discussion to lead us what else is needed. Yeah. And SAGs, the groups, the state advisory groups are good if you're talking to each other, but there needs to, because they represent a lot of the community as well. But we always have to maintain contact with those we serve. Yeah.
Yeah, what I would add to that is, there we were in Washington, D.C., having people from the ground come to D.C. and talk to us about, their findings, their experiences, what's working on the ground, sharing their stories, and providing written material and data on why it's working. I thought that was really important for all of us member practitioners, along with the federal agencies, to listen to. But it wasn't just bringing people to DC to hear from folks on the ground. It was also us as a council going to the field, out into the community and seeing what works and what's been helpful. And so I think the importance of the listening sessions or the recommendations that we're receiving from the field, it was important for us not just to be able to listen, but also to report back and talk amongst each other, talk amongst the federal agencies such as, Division of Labor, Housing Department, so many different departments that have an integral and important role in making sure that we do what's right by the report and what we're supposed to do within our roles to write these recommendations to the president. And so I think the process was a very healthy way to give people within our communities a platform, which most people in our communities don't have a platform to be able to share our work about. And so that was important to the field, but it was also important for us as a council to join the field like we did in Texas, I believe, in Houston, and in other areas. So that's what I remember from the process that I thought was important and critical to formulating these recommendations. Josh?
Thanks. Joe, I'm curious from the perspective of a former leader at OJJDP, how you would respond to what Mark and Michael just said.
Yeah, I mean, I think well, I'd say that it's validating that the process that OJJDP embarked on did make those connections, and to hear Mark and Michael reflect on that in such a positive manner was sort of what the agency was going for. And again, I guess I just keep wanting to bring it back to, this can be done at the state level and the local level. I mean, it's not just because, and the federal government should set the example to a certain degree. I mean, it is an appropriate role given that state systems are very state-based, but this notion of having a framework that hears all of the sort of players in the system, that is inclusive, that is youth-centered, state entities can replicate that. So the SAGs can replicate that. I would encourage state SAGs to go out and have town hall meetings or have listening sessions, for their board, much like the board of this, the coordinating council, to really double down on making that connection, and as Brian Stevenson likes to say, get proximate to like what you're all here about. And so I think, in many ways, it's not just the recommendations, and we've kind of focused on this process piece, but it's really important. It's not just the things themselves that the report says, but it's the way in which the report got to those recommendations. It's really authentically connected to what's happening in the communities. And I think, there are a lot of people that work in the system that are disconnected from it, or so connected to it that they can't step out and see a different way to interact with a young person or a family, especially systems, don't know who else to talk to, who might be their counterparts in other state agencies. So I think, for me, what it's saying is that connectivity is really important. And can we replicate it? Can we not just take sort of the learnings from the federal level guidance? And I think some states are doing it, but it really should be a through line at all sort of levels to really be trying to build that connectivity and take those learnings and integrate it into how systems respond to kids.
I want to give one other shout out, especially to Michael and Mark, because one of the things I really appreciate about the practitioner's report and this conversation that we're having is it gives a roadmap to people on this call, to people in communities to say, how do I connect to this work? And I think that call to action that you can find in that report, it says, look at the continuum of care. And here are your opportunities to do something, right? In workforce, in diversion, in out-of-home placements. And so I love the way that this work puts the ball in everyone's hands in our court now to say, how can I engage with this? How can I do this in my work? And so I just want to give kudos and ask if you have any final reflections about that piece of it before I promised Josh I would take the next question.
If I could say one more thing real quick, just so you folks understand, when the practitioners finally we're together as a group, and I don't know if this is ever shared, we had a Texas sitting judge from one of the southern counties, Hidalgo, from Texas. We had an attorney who represents youth in New York City. Yeah, we had a youth civil rights advocate out of San Francisco. We had a lived experience young lady out of the state of Michigan, Michael. We had a foundational executive that was there as well from the community. And I think that pretty much everybody, right, Mike? I think so. That was the small group. We didn't get the full 10, but that was the makeup of what we came out to be the practitioner report, so that we weren't all from the same mode. Yeah. We all had different perspectives, different work, different population, different jurisdictions that we came from, and we were able to agree on what you folks see in this report. I just wanted to share that with you, the makeup of the practitioners. Thank you.
Ditto, nothing further out of my end. Just that I'm so grateful to have a really strong team, even within the coordinating council, that was supportive every step of the way.
Both for the thoughtful work and for giving everyone a charge. I'm going to take probably two next questions. One of them is a question that's open in the Q&A about how the practitioner's report gets all the way down to recommendations levels about enforcement of the Olmstead Act. And the audience is curious about what that is. So Olmstead actually is a 90s Supreme Court decision about individuals with disabilities who were being incarcerated at high rates or institutionalized. So the Olmstead Act talks about implementation of ensuring that we don't over-institutionalize people with qualified disabilities. And it runs really similar for those of you connected to this call who know the core requirements of the JJDPA. This aligns with, right, not institutionalizing status offenders or those who are not engaging in activities that are crimes, to make sure that we treat them at home and appropriate to their needs, abilities, and development. So that's what the Olmstead Act is about. I also am going to answer two more questions really quickly because I think they're quick ones. There's a question in the chat about whether this paradigm includes a public health approach. And I think the Continuum of Care is aligned with a public health approach and was actually adopted by the Health and Human Service Agency as a health approach. So it was not just Department of Justice and OJJDP who adopted it. Other agencies who align from a public health space adopted the Continuum of Care. And my last quick response that I see in the Q&A is whether DOJ communicated about why certain things were being pulled down. I think lots of us could answer that question in a lot of different ways. I think initially my response is there were executive orders that came out of the current administration very quickly. And so things were pulled down to ensure compliance with current executive orders and marching orders for how the current executive is going to function, right? And so that was the first piece. I'll actually tell you that right now that full report to White House and Congress is back on OJJDP's website. The practitioner's report as of yesterday was not, but things are changing. I think as they're getting through the review process, things that are deemed okay are coming back up. We don't know what the status of this report will be, which is why we have been emphasizing the really important thing that you all can do, which is make sure that these reports are available. The Sentencing Project has hosted them on their website. website. Everyone here is going to receive a copy that you can download, share, put on your sites, etc. So thanks for being a part of keeping them alive. I'm going to look to Josh in case there's other questions we want to.
Yeah, I think because we have a little bit of time left, we got a really interesting broad question about how do you improve recidivism? And these are the kind of good questions that were asked in the listening sessions in the community. And I'm curious from Joe, Michael, Mark, what your answer to that is from having been so close to the system and as experts. What have you taken from this process of how one reduces recidivism?
I can start, and if anybody wants to help
Yeah.
chime in, please do so. Personally and professionally, reducing recidivism, what comes to mind for me is having a strong community. I think it's important to note that what good has come out in the last 10 to 15 years is nonprofit work that's really being strengthened to provide wraparound services to young people and adults coming home. But it's not just, an organization providing, meetings for children to go to or people to go to, but I think it's providing meaningful opportunities for young people to be civically engaged in the work that's being done. And what I mean by that is, at least for me coming home, I know older as an adult, but still lacking a lot of the resources. What was really critically important to me was being re-engaged pro-socially with society. Young people lose trust at such a quick young age. I lost the trust of so many adults at a young age, and it was hard for me to trust people, period. And reintegration should be that. It should be, how do we help young people rebuild that trust with their communities? And that comes through, community programs, civic engagement, credible messenger opportunities. And I fully believe that we re-engage young people and anybody coming out of incarceration, meaningfully engaging them in pro-social opportunities that help us socialize with the community and rebuild trust goes a long way in terms of reducing recidivism. But yeah, I'll stop there and see if my colleagues have anything to add as well.
So can I just jump in and say, I think that's the beauty of the continuum, is that there isn't just one thing that reduces recidivism. It's about sort of wrapping yourself around the young person, their family, and in the community. I mean, the visual really encapsulates that. And so from a policy perspective, it's about translating exactly what Michael said into sort of public policy and priorities, or at least principles that drive funding decisions. I mean, let's all get real here. Money's got to support some of this stuff. And you've got to create the spaces where that connectivity can happen, and it has to be a priority. And it can't just be, we're going to do this program, in a silo over here, but this kid is at a school, this kid might be in an after-school program, this kid is in a, whatever the family dynamic is, wherever they're housing or not, or they're homeless, like if you don't sort of understand and look at the kid, the young person holistically, you're not really going to get the recidivism that you probably want. And that metric is just very limited as far as, thinking about what it means to have healthy young people and safe communities. I mean, the healthier communities are and young people and families are, the safer everybody is. I mean, so this public safety narrative that like reducing recidivism is all that we should care about is very limited and is not going to get at exactly what I think Michael has described, from a hands-on perspective.
Really and clearly have an understanding and a definition that everybody understands on what recidivism is. Yeah. Every state, every jurisdiction is going to be different. Is it 1 year out and a crime we committed, 2 years out, 3 years out? We really have to understand what is the definition. When we throw recidivism, what definition are you using for that so we all can be on the same page? I have that argument all the time in Hawaii. Legislators use it, department heads use it, community use it, and they all have different definitions. Yeah. So how do we utilize and have a single number for recidivism. In a state like Hawaii, people would say, Warden, we think the recidivism rate is going up. I said, I have 20 kids incarcerated in the entire state of Hawaii. You know, what recidivism are you talking about? If 5 kids come back, they don't come back, you know, I shouldn't be, you know, these 20 kids that we're incarcerated are the most vulnerable children that we have right now. Yeah, every aspect of why they're there is what we should be focused on, more than why they're committing the crime and coming back. You know, they have failed in our diversion, and they're only here because we don't have the answer yet. Yeah, and until we have an answer, they may still continue to be in their behavior. But in the meantime, we need to start looking at how do we improve and not use recidivism so negatively until we can understand truly how it affects our system. That's my 2 cents.
Excellent, thanks. Melissa, do you have any thoughts about that?
About reducing recidivism, I have for a long time said that we have to address root causes, right? So it actually doesn't matter where a young person is in the system, if they're in the prevention stage, if they're in the intervention stage, or if they're in the reintegration stage. Young people are navigating different points of risk. I'm stealing that phrase from a young person that I've worked with, who's now a incredible leader and on their state advisory group. But they're just navigating different points of risk, and where they are one day versus where they are tomorrow has more to do with their environment and their circumstances than any point of entry into the system. And so my core recommendation is that we have to continue to address root causes regardless of point of system contact.
Yeah, I think what's so remarkable about this report is you look at the continuum of care framework is that it really does understand this cycle of the idea that there is one moment for an intervention is not correct. I mean, that there are so many opportunities for reintegration and connecting kids with positive programs. I understand the question. It's the reason why I pulled it out, but it's like, don't we all want more for our kids than just not being justice involved? Like what a thriving childhood and adolescence and young adulthood looks like. That's what we should be measuring, you know, positive outcomes of contributing to the community and high school graduation and college attendance. These are really great things. And we know that deeper involvement in the system interferes with that life trajectory in a way that diversion programs don't. You know, no program should be expected to have 100% success rate. They certainly don't, but we can look at the evidence of what actually works. And I'm really pleased to hear this from our panelists today. I'm looking at the clock. We have about 5 minutes left or so. And I see a question coming in from Gail, who's talking about her personal story. And I really appreciate your willingness to share this. And she says, what are ways that we may invite and partner with boarding school survivors / ACE survivors, that's adverse childhood experience survivors, in our homes, schools, and communities? As I shared my personal story of survivor, I was told by an administrator that no one cares. So first, we care, and I'm very sorry that you had to go through that. I'm really curious to hear what opportunities each of you have seen in your professional capacities to make sure that lived experience is elevated and valued as a kind of expertise that really needs to be listened to and acted on. Jill, why don't you go first?
Okay. So, I mean, I have experience in a couple of different areas in working with young people who've been incarcerated, who've had contact with the system. And I think you, and I'm more of a policy research sort of perspective, but I think you have to create the spaces and support those young people. I think young people are often, and individuals who've had lived experience, and certainly Michael can speak to this more than I can, get thrown into situations to tell their stories, and they're not really supported, and it doesn't feel like it's always a very safe environment. So I think there needs to be a commitment by decision makers and policymakers who really want to have that input inform their decisions, to understand that that's going to take a little bit of effort. Like caring does take some effort. You can't just sort of be cavalier about it. And so creating spaces and opportunities and supports. I've worked with groups of young people who've been system involved, and, you know, some days they're very present, some days they're not. And again, I come back to the continuum of care and looking at a young person holistically and really understanding that some of what their past trauma is affects how and when they show up and what that looks like. And so I think as adult system folks who are allies and want to work with young people in this way and get their input when it comes to the policymaking decisions that systems have and legislatures have and whatnot, that you have to really understand that and be mindful of that so that it's done in really authentic ways, I think, that don't cause more trauma for the young people who are telling their stories, or the young adults who I often have worked with. And I'm looking at Michael like, I hope that made sense to you, because I'm working on doing it really well here. So
I was actually hoping that we could have, I was hoping we could have Michael get the last word in after, if Mark has anything to add, because that particular question I think is really best directed to him, but I want him to speak last on it.
You know, we're beginning to see in Hawaii a lot of our, you know, we've had a huge trauma informed care movement in Hawaii for probably the past decade and a half, where we now have an Office of Wellness and Resiliency in the governor's office. The governor announced nationally that we are a trauma-informed care state. Yeah, and so people are all gearing up. A lot of our nonprofits are bringing on lived experienced youth and young adults to work in the child welfare and the child and adolescent mental health arenas. And they're making their way through the state systems, those who are able to get a college degrees. But we're trying to do advocacy that the college degree is not what we're looking for. We're looking for the lived experience. Yeah, the easiest for them to come in and interact with a family and be effective from the day they start and the interaction. And so lived experience is very important for here in Hawaii. When we talk about the question specifically for the young lady, you know, we have restorative groups throughout the state in the judiciary, where, you know, and in our nonprofits, where trauma is shared in the sense of people have experience, because a lot of people don't understand trauma. They think that's life. Yeah. And then when you define it for them and you work it out with them, then they understand, okay, then I am traumatized. I do have PTSD. I do have this. I do have that. So it's a journey. Yeah. How do we bring more of those people together so that the stories can be shared? Yeah. Michael?
Yeah, thank you, Jill. Thank you, Mark, for those responses. Love them. You know, it's an interesting topic that I do think needs to be discussed more. Because yes, lived experience is really, really important. But it's important when there's a purpose. It's important to meet young people and advocates where they're at in their trauma, and when we engage them in our advocacy efforts. And I say that because, as we all know, you know, sharing the worst thing you've done could be traumatizing while we're doing it. Or I guess what I'll say is, I always love to see that when people work with those that have lived experience, that there's follow through, that there's an intentionality behind someone not just telling their story for the purpose of telling their story, but telling their story for a higher purpose. For like, for example, like we have young people and folks tell their stories to legislatures, to elected officials, towards passing a bill. But we're not just involving people with lived experience at that one initial point where they're just telling their story and we never see them again. We involve those people throughout the whole legislative process. We share with them about what the bill language looks like. What do you think about these amendments? You know, when we engage people meaningfully across the spectrum of our advocacy opportunities, and when you do that, that avoids exploiting people, because you're engaging people more meaningfully in the process of change rather than just expecting a story. And so I know we always want young people to be a part of that, but sometimes it could be more harming to include a young person who is not ready. to tell a story versus preparing them to help civically engage. So that, I mean, it's just what's been on my mind. It's important to have, but also important to be mindful of.
Thank you so much.
you,
A
Michael.
very big thank you to Michael and Mark and Jill for sharing their experience and expertise. Thank you to Josh, the sentencing project team, and my CJJ team for all the behind the scenes work that went into making today and this opportunity possible. And thanks to all of you for engaging with us and in this conversation about these important reports that we hope will be useful to you as we keep moving the work forward. Thanks for being here.